Okay, with that, we are going to begin. So again, thank you all for attending today. I know that everyone has really tight schedules right now. We're really grateful for you to share your time with us as we go over this year's annual report. I am Allison. I'm the manager of partner training support and engagement from MICAH. Today with us on this webinar, we have Jason Weller and Christina Souliard, who are both with MSHDA. And then we have Gary Leslie, who is at MICAH as our HMIS director. So they all are talking about a different section of the report. You'll see that this year's report is a little different than before, but that's why we're here to walk you through it. If you have questions, please put them in the Q&A. We will try to get to as many as we can for this webinar. We will hold questions till the end. So just keep them coming and I will make sure to keep an eye on them and report them out. We are on Zoom today. You have been muted. And with that, we're going to start with a couple of poll questions to just kind of get a base of where we're all at today. So this first poll asks, have you read the 2020 annual report? Yes, all of it, some of it, or no. That's why I'm here.
And we should say that it's anonymous and we're not holding anything against anybody. So, so if you happen to fall into that last category, totally cool. Like it says, that's why you're here, to learn about the report. So no harm, no foul if that is you.
Okay, we have about 84% of respondents. I'll give it another second and then we will share the responses. All right. So it looks like we have the highest number is no, that's why I'm here. Rounding it out second with some of it. And then a small fraction of you have read all of it. So good for you finding time for that during these really busy times. All right.
We will give out some virtual gold stars after the presentation to those of you who have read the whole report.
That's right.
And if anybody's read the repot too, we definitely are thankful for you as well.
Did I leave a letter out?
That tells you how crazy this day has been.
Yeah. All right, I'm going to launch our second poll. So this one asks, how have you or your organization used the data from the annual report historically? So you can answer as many of these options as are applicable: local media engagement, fundraising, Homeless Awareness Month, awareness raising materials, other, and we would love your other responses dropped in the chat so we can get that information, or we haven't been using the annual report data. So I'll give you guys a few minutes to, well, probably seconds to answer this. We're at about 50% of respondents. So keep those answers coming. This really helps us know where our audience is at and how to best provide information for you today. Okay, well, we're holding steady at 6. Oh, we're going up. All right, folks, good work. Keep the answers coming. Okay, I'm going to give it about 10 more seconds.
This is where we need the Jeopardy theme music. We can just have it playing in the background.
Yeah, you don't want me to sing it. Okay, thank you all. So with this poll, we have 82% at Homeless Awareness Month awareness raising materials. So that's fantastic. Just a little plug. Homeless Awareness Month is November, and the theme this year is harnessing the power of your community. Then we have a pretty close second with fundraising and local media engagement. Then all the others in the chat, which we appreciate. And then 3% have not been using the annual report data. So thank you so much for that information. That is my part is concluded. I'll be back for questions at the end. And I believe Jason and Jerry are going to start us off with the content.
Yeah, so thanks, Allison, and thanks everybody for dropping for participating in the poll questions, and then also dropping the comments in the chat. Been trying to keep up with those while looking at everybody's responses. I think the big takeaway is so few of you are not using the data. You know, when it's 3%, it's, you know, it kind of underscores the imperative for having this webinar, for producing the report, making sure we're getting that information out into your hands. And so this year we have changed the timeline up a little bit, because normally we release the report, and usually simultaneously or close thereafter we put a press release out at the state level, and of course we know that that results in y'all at the local level getting media inquiries. But with 2020's report being such a different beast, and recognizing that nearly half of you haven't had a chance to look at it at all, that's why you're here. Spoiler, this report, much like 2020 as a year, is very different than the things that came before it. So early on in the process, both the writing team, the Michigan Homeless Policy Council, the Michigan Interagency Council on Homelessness, the two organizations that kind of sit over the production of the report, there was a broad recognition that we needed to really go a different direction with this particular report, and make sure that we kind of captured the unique challenges and opportunities that 2020 presented to us as a, you know, homeless service delivery system. So I think, you know, as we walk through the report today, you'll see that for those of you who are familiar with the prior year's reports, and it looks like a lot of you are familiar with the prior year's reports, you'll notice that there's some very fundamental changes. And yeah, so we really want to take this opportunity to highlight those, and also have some dialogue. Because as I was saying with the timeline, normally we'd have a press release out, but with this report being so different, we wanted to make sure we had a chance to engage with folks, answer questions, walk everybody through the report before we put the press release out. So we are planning to do a press release, but it'll probably go out in the next week or two. But we wanted to time it to have this webinar first. So with that being said, Jerry, do you want to walk folks through some of the kind of fundamental changes and differences between this year's report and our prior reports?
I would be happy to, Jason. And if you would like to, we'll jump on over to the map page and we will go through and talk through some of this a little bit. So we did have a major fundamental shift in this report. And the major fundamental shift is, in previous years, we included coordinated entry, coordinated access data within our homeless counts. One of the things that we did was we included any coordinated entry, coordinated access data where there had been a service transaction attached to a client record in the system. One of the challenges with that, though, and what we saw with the data from year over year, is there were some places where, especially where you may have had phone intake taking place or phone screenings taking place, where there had been a call or call in one time, potentially report as being homeless, and there was no other touch anywhere in the service delivery system. And it was leading to exponential increases within our homeless numbers as we were looking at the report. There were some concerns about that, specifically because not having them touch any other place of the service delivery system, nor having them make contact with coordinated entry at a second time within the system, of whether or not those were actual illustrations of people being homeless within the service delivery system. In addition to that, there was also, as many of you know, some very significant changes to the coordinated entry requirements that initially were to be implemented in 2020. And with hitting COVID and getting into the window that we were just in, unfortunately, those changes ended up being pushed off by quite some time because everybody was gearing up and ramping up with their COVID responses. And with the two factors coming in together, there was a definite gap that we were seeing with coordinated entry data. So what we made the decision to do during the 2020 report was to take and exclude coordinated entry data and include only what HUD would be. This is, again, from a perspective of system performance measures and the longitudinal system analysis, the HUD's metric for determining homelessness, which was to include persons that were touching emergency shelter, safe haven, which we really don't have many of in Michigan, transitional housing, and then street outreach. And that became the core of how we were doing calculations to determine whether or not somebody was homeless within this report. So one of the first things you can see is the numbers are quite a bit lower than what you saw in previous years, even beyond the fact that we did see a decrease in our homeless numbers in 2020. And that is largely due to the fact that we did exclude those coordinated entry numbers as we began to gear up for implementing coordinated entry in the new fashion with the new process that HUD has implemented for us. One of the things to let you all know, though, however, is the 2019 data you see here. If you compared it to, let's say, the 2019 report we actually published, we are comparing this 2019 data in this report to the 2020 data using the exact same metric. So we pulled 2019 data based on the same logic that we pulled the 2020 data. So you had comparable data sources. So this is going to be a comparable data set from that standpoint. But again, if you go back to the 2019 report, you're going to be seeing quite a few differences between those reports. And it largely has to do with the methodology difference between the 2019 report historically and the 2020 report. So with that said, looking at the chart here, we saw a couple of very big shifts. Number one, the biggest thing that, and this probably will not come as a surprise for many of you working on the front lines and addressing issues of homelessness, the number of people we saw in 2020 was a significant drop-off, a drop-off of about 19% of what we saw in 2019. There was a slight increase of about 4% in Region 1. However, if you look at the rest of the state, we are looking at, for the most part, double-digit decreases across the rest of the state, which is indicative of the service delivery patterns that we were seeing with agencies. And in just a little bit, I know Jason and Christina are going to be talking about specifically what are some of the things that we've identified as being some of the root causes of that decrease. But across the board, largely because of COVID, we did see a pretty significant decrease in the number of people we served.
Okay, so as Jerry said, one new element that we dove into this year is trying to unpack that 19% decrease. And so the writing team figured the best thing to do, looking at that map that you all were looking at, that was the data the writing team was looking at. We were trying to unpack that, and we said, you know what, the best thing we can do is reach out to the regions that saw just decrease. So, and by that, we were saying we made the cutoff larger than 20%, and ask them what factors contributed, from their perspective, ask them what factors contributed to this decline. And so that is the list that you see here on this page. So this is definitely new territory for the report. I think in years past, we've reached out for quotes from maybe program participants or maybe even program staff, but we've never had a situation where we had designed a survey and we were getting both qualitative and quantitative feedback from COC and local planning body leadership that was ultimately incorporated. So what were the primary drivers? Well, the bottom line is it's complicated. So it's not like, although we have this listed as 1, 2, 3, 4, I think the big takeaway that we saw from all the feedback we got was that it was kind of a mix of all of this. So there was not one primary driver, but there was kind of the soup, so to speak. And so we highlighted the kind of top things that the folks elevated in their responses to our questions. So number one, you see the eviction moratoriums. As a reminder, throughout 2020, we had eviction moratoriums. I don't know, is it moratoriums? I've heard both in place at the local, state, and federal level. The city of Detroit had its own moratorium in place for part of the year. The state of Michigan had a moratorium in place. And then, of course, we had the CDC moratoriums. Later in the report, we go into more detail about the timelines for each of those. In some cases, I think with the city of Detroit, their moratorium did overlap with some of the other moratoriums, but in most, I think there was a little bit of a gap between what we saw at the state level and the federal level. Needless to say that the moratoriums had the intended impact in that they drove down the number of evictions and, of course, created some stability. At the same time, we also had the creation of the eviction diversion program. And we all know that story. I think at this point, at least I'm assuming most of the folks on this call know that story, that we had the $60 million, that was all spent out. Kind of first time ever that we had this opportunity at the state level. We know that we had a handful of communities across the state that had some type of eviction diversion program in place. And so we really leaned on, and I should have referenced this with number one, we really leaned on the 2021 Poverty Solutions Eviction Report, which if you have the PDF, and I know that we just dropped the link to the report in the chat. So if you download this, everything that you see highlighted in blue on this page are hot links. So it'll take you right to the original source material. And so the Poverty Solutions Eviction Report goes into a lot more detail about the positive impact of both the moratoriums and in combination with the eviction diversion program, and how that really nearly brought evictions to a standstill. And then 3 and 4, this is definitely where I think things get a bit more nuanced and or complicated. And the feedback we got we had kind of two things happening simultaneously. We had number 4, we had the stay-at-home executive order, and this was the executive order that Governor Whitmer issued, asking residents to kind of shelter in place, especially early on. And then kind of coming out of that, where a lot of guidance around what social distancing and all of that looked like. So that combined with just a lot of uncertainty, we saw that folks who needed services were less likely to seek services in a shelter environment, and were more likely to stay with friends, family, or stay someplace else. And we do know that sometimes that resulted in folks deciding to sleep out or to sleep in an encampment, as we have noted here. So that's why I said that, it's complicated. While we're grateful to see 1 and 2, kind of that tandem of the policy solutions and seeing them contributing to the decline, we know that there are other factors at play as well. And I suspect that for those of you who are on the service provider side of things on this call, you'll likely probably have 3 or 4 other things you could add on to this list and say, yeah, that's a good start, but this is what we also saw in our community. And especially as you're leading into, if you're doing any type of media engagement work, we encourage you to think about things at that level as well. So one aspect of the report that has been in its existence for the last couple of years, and I think we slowly have been bulking up the content, has been really kind of diving into the racial disparities that we've been seeing in the homeless service delivery system. And this year's report is no different, in that we know that COVID has had a disparate impact on especially Black and Hispanic folks. And I highlight those because those were the 2 groups that we had the most concrete data on. And so those are the 2 groups that we kind of focused on in this particular section. But one area of difference is that so last year's report, we kind of started to go much wider than the HMIS data. We looked at CSH's SDDI data. Don't ask me what that stands for. I knew at one time, I don't remember anymore. But we also looked at some national low-income housing data and some other data sources for last year's report. This year, we blew the doors wide open, and we pulled in remarkably disparate data sources. And that's where you really begin to, you saw that a little bit on the last page with the evictions report data, but you really see that here. So we start with job insecurity, and we looked at the Economic Policy Institute's analysis of Bureau of Labor Statistics. So the big takeaways are kind of packed here in the middle of this particular paragraph. In the second quarter of 2020, Michigan overall had about a 20% unemployment rate, with 17.5% of the white population being unemployed, and 35.5% of the Black population being unemployed. And that 35.5% of the Black population, that was the highest in the country. And then by the fourth quarter, we see those numbers start to settle down, but we still see these disparities where we have an overall unemployment rate of 6.9%, but unemployment for the Black population is still at 15.6%, whereas for the white population, it's 5.3%. So yeah, the numbers kind of speak for themselves. And then we see something similar playing out with the housing insecurity data. So here we looked at household pulse survey, which I did not even know. I'm a self-proclaimed data geek. I've been involved with writing these reports for a very long time. And it was only in looking at some of the national reports that were coming out, and they were really highlighting and leaning on this national household pulse survey data, that we realized that there was a bit of a treasure trove that we could explore. And so in particular, we looked at the housing insecurity from the perspective of renters, but they also have homeowners, they have other data points as well. So if you're also a self-proclaimed data geek, I highly encourage you to take a look at the hot link, because this just takes you to the household pulse survey, and then you can kind of play around and look at the different data sets. So we looked at two different data points through 2020. We looked at the end of April, and we see that 19% of Hispanic renters, 40% of Black renters had little to no confidence in their ability to pay their rent on time, as compared to 19% of their white counterparts. And then by the end of 2020, so this is after all those eviction moratoriums, the EDP, and all the other supports that have been put in place, we're still seeing that 38% of Hispanic renters, 30% of Black renters, and at this point, even 25% of white renters are still feeling little to no confidence in their ability to pay their rent. So we're seeing that, again, that disparate impact kind of play out, and the numbers speak for themselves. And then the last thing, of course, with 2020 and COVID, we also wanted to highlight the disparate impacts that COVID itself has had. And in last year's report, we started to dive into racial and health disparities by race as well. And so, kind of continuing in that trend, looking at how COVID has disproportionately impacted Black folks and Hispanic folks as well, compared to their white counterparts. And so you see that play out here in the numbers, where the Black population was over 40% higher, had higher infection rates, and the Hispanic population had 70% higher infection rates. And of course, we go into a little bit more detail about the various outcomes and some of the factors that play into that. And the systemic, in particular, I think the systemic discrimination that Black and Hispanic folks have been subject to. So let me see. I think I covered all of the kind of primary things from here. So I'm going to go to the next page and hand things off to Christina.
All right. Thanks a lot, Jason. So the next two pages of the report really deal with an overview of the overall response to the pandemic. And as Jason's already highlighted, We've been able to leverage a lot of unique data sources, especially compared to how we've historically built this report. So the first of those sections that we're going to talk about is actually data that we were able to partner with 211 to receive, and 211 statewide. So taking a look at information from them about calls, texts, chat messages that they've received through their system, and filtered those requests to share information with us. So housing related inquiries to 211 have consistently been at the top of the field of requests that they received. 2020 was definitely no exception, but they did see a significant increase, an increase of 95% in those requests that were related to those that were at risk of becoming homeless or looking for homeless housing related assistance programs. And likewise, on a more positive note, referrals to those types of programs increased by 72%. In 2020. And much of that is related to the increase in resources that were available. So as Jason mentioned, the eviction diversion program, which we'll talk about kind of throughout this report as it impacts different areas, but that was a significant source of availability of funding and supports for households in crisis. There was, so compared to that referral piece increasing to 72%, it was matched with substantial decreases in unmet needs over the same time period. And again, that was related to the availability of those rental assistance programs, and also the moratoriums that were in place significantly impacted that. And at the same time that these increases in overall requests were coming through, other types of basic needs saw increases in requests as well, which is just a reflection on the fact that loss of income doesn't just affect housing. We know that, but it's also evidenced through the data that 211 shared. So we saw increases for requests and assistance for gas, electric, water, and food assistance related to 211. Jason, could you go to the next page, please? Thank you. And then the next section that we wanted to talk about were the decline in evictions over 2020. And, you know, again, a lot of this information we were able to source from the Poverty Solutions Report, which was the Reducing Michigan Evictions, the Pandemic and Beyond. That came out in May of 2021 this year, and that is hyperlinked within this section as well. So prior to the pandemic, there were over 14,000 eviction cases per month statewide. During the summer of 2020, that dropped to nearly zero. So huge impact that was detailed there through this report, through the data that was gathered. Overall, there was a 65% decrease in cases from April to December in 2020 compared to the same time frame in 2019. So these substantial decreases in evictions are connected to multiple factors. So as Jason referenced earlier, multiple and layered eviction moratoriums were in place. So you had the national level, moratoriums at the state level, and then at the local level as well. Each of those in their own space played a huge factor. The overall availability of the EDP program, the rollout statewide, the fast infusion of funds at the local level, and it cannot go without saying that it's not just the funding, but also the partners at the local level and the agencies that were able to stand up this program so quickly and get that rolled out. That had a huge impact. And then coupled within the eviction diversion program was the increased access to legal assistance and representation. So even within EDP, 32% of cases under EDP had access to legal representation and assistance. And of those cases, 97% avoided eviction. So some pretty clear indicators here of the positive impact that having access to legal aid resources has for households that are going through the eviction process. So lots more to pull out from there. We're kind of, as Jason said, we're doing a high level overview on this one. So lots more to share through there, but very exciting, a lot for us to learn and hopefully replicate as we go forward. The last section within this grouping it references the increases in incidents of domestic violence. So according to the National Commission on COVID-19 and Criminal Justice, there was a 8% increase in reported DV incidents during 2020. We know that DV is historically underreported. So it's very likely these numbers are much higher. And the stay-at-home orders limited movement for folks. There was heightened insecurity during 2020. There was increased isolation, and the mixture of all these things really increased the chances for domestic violence to occur. In Michigan, we know that 36% of our, sorry, I lost my page there. 36% of women have experienced physical violence, rape, or stalking in their lifetime. And for those that are experiencing homelessness in Michigan, 92% of homeless mothers have reported experiencing physical or sexual assault. We know that this is highly prevalent, and unfortunately, we also know that these trends through into 2021 are likely to continue to rise. So this is a growing area of concern, and one that we know our partners at the local level are trying their best to engage with and to work through, but it can be very difficult, again, with the historic underreporting and during 2020, the stay-at-home orders definitely negatively impacted those numbers and those experiences. From here, Jason, I'm going to pass it back to you.
And thanks, Christina. So we wanted to create some space within the report to highlight the innovative responses that the homeless service delivery system created in response to all the challenges that 2020 threw at us collectively. So what you see here is kind of a short laundry list of some of, I think, the things that we know the service providers are doing across the state. I don't think there's going to be anything here it's going to be too shocking or surprising for anybody on the call. But, starting with, we know that shelters and service providers in general had to reduce capacity due to support social distancing, screening clients daily for symptoms, created isolation and quarantine spaces. We also know at the same time that organizations and agencies were experiencing staff shortages. At the same time as you were spreading people out, both staff and volunteers, interns, what have you. And then implementing those new protocols, for safety, whether they were masks or social distancing, and then the new cleaning protocols as well. And all at the same time, while many of you were also losing volunteers. So lots of different things that y'all were going through. And so so in terms of kind of capturing the kind of coordinated system-wide response, we know that by late August of last year through the end of the year, we had systematic testing in place at shelters. And we were happy to say that during that time period, over 80 8,600, not 3,600, 8,600 folks were tested. And that was both for clients and staff through programs all across Michigan. And then here at the bottom of the page, we get into some other things that some other innovations and evolutions, I think, in service delivery that we saw happen last year that are obviously keep being carried through to this year. First is the street outreach and the way that street outreach teams, kind of like everybody else, pivoted on a dime and figured out what they needed to do to continue to be able to go out into the field and engage with folks in a safe and effective manner. And so, figuring out what, and at the same time, getting hand washing kits, PPE, testing kits, all of that stuff, getting that lined up, getting that available for folks. And then I think the other thing that in particular I want to highlight here for today's session is the outreach teams advocated with local governments to ensure that any homeless person found on the street was brought to a shelter instead of taken to jail. And that is, I know that there's been lots of conversation in different communities across the state around criminalization of homelessness, but good to see that this was an opportunity for the street outreach teams and local governments to have much more intentional conversations around this particular issue, and put new practices into place, ideally. And then down here at the last item on the list, but certainly not the least, is the pivot to the use of technology, both with clients and with colleagues. Both at I think we've seen this play out at the local level, and with us just winding down our second virtual summit, we see this playing out at the state level as well. That folks are much more willing to lean into the technology, the use of phones, whether you're texting or calling, whatever. But whatever that looks like, we know that the service providers have made that shift at this point. And then I think the other important thing to highlight here is the fact that we figured out the technology gap or creating systems whereby folks can upload documents via their cell phone. So, and I think a prime example of that is the SARA program, and the fact that folks who are applying for assistance can, they just need a phone with a camera, and they can take pictures of all the things they need and submit their application. So, recognizing that with these challenges, some of these innovations are things that we hope are able to stick around. Because I think these are taking us in good directions. So with that, I think we now hand things off to Jerry to talk about strategic performance. Oh, not yet? No, back to Christina. Oh, I got 2 more pages. Back to Christina, that's right. How could I have forgotten? Okay.
It's all right. There's a lot of stuff going on. So, 2 more pages, then we're going to dive more into the system performance measures. So, again, kind of based on the feedback and information that we got from our communities for what their experiences were in 2020, we were able to identify some of the most referenced challenges. I want to spend some time talking about those and kind of encapsulating some of that data here. So personal protective equipment, or PPE, there were challenges early on with gaining access to those materials, working through training of how to use them safely or put measures in place to maintain safety within our shelters, within other areas where there's direct contact, like street outreach that was talked about earlier. So that was one challenge that was identified. Another, finding and maintaining staff. And I think we recognize that as kind of an ongoing challenge for a lot of our partners in, identifying folks to bring on board, moving to virtually onboarding staff. That can be a very brand new experience for a lot of our partners. Most folks coming into this work were not working remotely prior to the pandemic. And so again, a lot of pivoting and changes in practice to bring staff on, to have enough staff available, to have the capacity available to keep the work going. We also heard from a lot of folks about finding locations to quarantine. So relationships were made, partnerships were developed with hotels and motels to navigate some of that space. There were other creative uses that we saw in communities to identify and connect with quarantine space, but it took a lot of work to get there. And a lot of processes need to be developed to do quarantine in an effective way. So just recognizing that while ultimately we were able to find a lot of success within these practices and work, there were still challenges with it along the way. Number 4 is not going to be a surprise to anyone, lack of access to rental units. That is consistently, that was an issue before the pandemic. It certainly was emphasized, highlighted, exacerbated by the conditions of the pandemic as well. According to the National Low Income Housing Coalition's report, Michigan needs more than 200,000 rental units that are specifically for extremely low income households. We know that we're not at that point. The pandemic highlighted that for us. And conversely, the eviction moratorium, which helped to keep so many people from possibly becoming homeless through that process, it also limited the turnover of units that communities were experiencing, maybe without even realizing it, to be honest. And so that has also contributed to an overall diminished number of units to access. And then finally, the lack of capacity among shelter providers, and this is looking, specifically at the non-congregate sheltering options. So those options weren't universally or consistently available for communities, especially with hotels that were shutting down or had limited access during the pandemic because of safety reasons. So again, just acknowledging these were some of the challenges that we experienced, some of the ones that came up most often for our communities and the discussions that we had. Jason, can you go to the next page for me? So then we want to do a highlight of those who have experienced homelessness for the first time in 2020. Again, recognizing this is such a unique year, we wanted to pull one of the system performance measures out to highlight and kind of talk about a little bit more in depth. In 2020, we had over 16,000 folks experience homelessness for the first time. Within that group, we took a look at the racial disparities, which sadly are consistent with what we see between first-time homeless and overall homelessness. We also looked at those that are under the age of 18 experiencing homelessness for the first time, which made up 22% of that over 16,000 group. And then again, within that same group, we saw that 20% had experienced domestic violence. For us, I think looking at this was a way to try to understand or sort through, were there other impacts that we needed to be aware of from the pandemic? Were we seeing more folks that were coming into homelessness for the first time? Were we seeing any differences across these other areas with age and racial disparities? And I think we found really a lot of consistency with our overall homeless population, but that was the pullout from the system performance measures. So now with that, we're going to slide over to Jerry to talk about those.
Very good. Thank you, Christina. And looking at system performance measures, nothing in here I would assume is going to be a surprise to you all. First of all, between 2019 and 2020, in just a second, Jason, I'm going to zoom in here so I can see a little bit better, seeing how I'm going blind in my old age. We did see an increase in the length of time homeless from 55 to 59 days. And again, this is going to be calculated using just the length of stay within emergency shelter number. So this is not taking into account like the length of time that somebody may have been homeless through an approximate date homelessness began. But we did see approximately a 4-day increase in length of time spent in shelters due to the COVID window of time that we were experiencing in 2020. Jason, hang on just a second. I'm going to pull up my report so I can see a little bit better here. And then looking at the next measure, which is going to be measure 3, this is going to be clients exiting to stable housing or retaining permanent housing. We did see a slight increase in some of the numbers on this. The first thing we saw about an 8% decrease in those exiting successfully from street outreach. A caution against totally interpreting this as being a decrease in performance of clients. And part of the reason I say that is actually within the last calendar year that we were doing this, we have been seeing an increase in effective engagement with street outreach, with number one, the increase in programs across the state, and number two, just really having programs doing more effective work and outreach. And because of that, one of the things that happens oftentimes is you do see a performance decrease, which may not be completely due to client outcomes. It may be just due to the fact that you're getting better at engaging clients and understanding where they're going and following up with clients. And we traditionally have seen this where street outreach programs are really getting their feet under them. It usually takes about a year or so from the time they first gear up until they really get functioning well. And so you'll often see a little bit of that performance decrease in that first season. So although some of this is going to be due to some of the challenges of performance because of the COVID-19 outbreak, I would hesitate at interpreting this as being a complete change in that. And looking at this as also being the fact that getting programs up and running and getting them effective what they're doing, this is one of the end results of the early parts of that process. We did see a 3% decrease in those leaving from shelters, transitional, and rapid rehousing. A slight performance decrease in this. Although the one good thing about it, and we continue to really across the state have high numbers in those exiting permanent housing. This is primarily permanent supportive housing. Either what they're doing here in this case is they're either retaining their housing during the course of the year, so they're maintaining their permanent supportive housing, or when they exit permanent supportive housing, they're moving on to another permanent destination. We typically have run about 95% across the state, which is an excellent outcome. And seeing that we're continuing to do that with no change is just a testament to the great work that's being done by our PSH agencies with engaging clients, providing case management and follow-up with them. And we're hoping to maintain that number into the future as we continue to do work around that. And then the last thing to look at, the one good thing that we are seeing is we have seen a decrease in the number of people, and this measure 4 looks at out of those who exit the homeless service delivery system to a permanent housing destination, how many of them returned to homelessness in 2 years? So our overall numbers from shelters have decreased 3%, which is a good outcome. Total returns are down 2%, permanent housing returns are down 1%, and transitional are down 3%. All of those are very good indicators, very good markers to see, and we're glad to see that. Just running over briefly to talk about the chart, the following demographics chart, please feel free to look through this at your pleasure. But the thing to, again, just reiterate is these numbers are based on the new logic metric that we talked about earlier in the report, that this is being pulled from persons who are engaged in street outreach, emergency shelter, transitional housing over the course of 2020. So these numbers have been modified. The 2020, but the 2019 numbers were also pulled using the same metric so that there is comparable when looking at this. And of course, this data is going to be subpopulation data for those who are in calendar year 2020. So you can take a look at that and see what we're experiencing in terms of both numbers and percentages for specific categories of persons experiencing homelessness. And with that, I believe we have about 10 minutes left, Jason, for questions or discussion.
So we did have some questions, but it looks like they were answered in the chat.
We're trying our best to respond to the questions that were coming up in the Q&A. I do think there's one question from Melissa about some of the data on page 11. So if Melissa, you can provide a little bit more clarity about which particular data you're referencing, because some of the data on page 11 came from the HMIS system, and some came from outside sources. And we tried to cite those where we could. So we'll see if Melissa is able to provide some clarity. I do think, I'm not sure if everybody's been paying attention to the Q&A, but Brian asked a great question. And I know, Jerry, you responded to it. And I'll just highlight it here in the conversation and encourage folks to take a look at it. But Brian was asking about how do you balance the decreasing numbers of the report with the perception from the general public and media regarding the very visual unsheltered homelessness, especially in the city of Grand Rapids downtown, homelessness along the street and in downtown parks and encampments, and in Kalamazoo with the very large 100 people plus residents encampments. There must be a way to document or estimate unsheltered homelessness in these large encampments. So Jerry did provide a response there. Jerry, do you want to add anything on top of what you already stated?
No, not really, but in those who may not have had a chance to see it, one of the challenges that communities face is often the very visible image of homelessness, which happens with encampments and those who may be in highly trafficked areas within the community are a small part of the bigger picture, the total number of homelessness that exists within the community. And Brian was asking an excellent question again, how do we make sure that those persons are being documented and that information is being collected so that you can get access to resources for those people? And really the key about that is making sure you have really active street outreach. One of the key things about being able to get persons experiencing homelessness who may be unsheltered and may not be in that sheltering environment, having them have access to the resources, is making sure that you're documenting that homeless history that they have. And this is where street outreach comes in to be a critical component. Because what happens is basically within an HMIS system, if a person is observed to be literally homeless and on the street for one day a month, that counts as being homeless for that month period of time. And as you have street outreach continuously engaging these people, you're building up that homeless history, which is what can help them in often getting them access to resources. And I think the second part about it is street outreach is really critical. And I wish my good friend Ryan Hannon from Traverse City was here, because he obviously, and many of you know, is really a expert in this work. But building that relationship and building that trust with people who are on the street experiencing homelessness, because often they may not have that trust in the service delivery system. So it's really critical to have that trust there so that you can engage them and get them access to resources that may be available to them through coordinated entries. So I really encourage communities who see that to really begin stepping up with that coordinated, with the street outreach and making sure that this linking to the work you're doing around coordinated entry.
So another question did come in during that, if we're ready. It's from Naomi. She's asking, is there a place where we can find this information summary broken down by county?
Jerry, I think that one's going to be you.
Yep.
Yeah. So there's a couple things. Number one, what we do is every a year, and this is going to be changing here in the near future. This information is not going to be available in the same way. But this year we did send out some information to each of the counties and the local planning bodies around the state where they could actually look at that data. It's going to be based on the old metric, including coordinated entry, but your local planning body should have received those reports sent to them. And if you want to get more of a picture of what's going on within that information, feel free to contact your local planning body because they should have that information sent to them from our MICA staff. And we did that last spring. So we typically do that around April of every year.
I am not seeing any more questions right now, but I'll give folks a couple seconds in case they are, because we do have 5 minutes left.
Hey, while we're waiting for questions to come in, if we could just take a moment to say thanks to the amazing annual report work group that helped to bring this all together. I don't know if we've got all of them attending for the call today, which is okay. They probably have a well-deserved break after reading and rereading this information, but we were super appreciative of everyone's time and involvement with that. And we'd also can make a plug that if you are interested, if you are excited or what did you call yourself, Jason?
Self-proclaimed data geek. I knew that was going to come back to haunt me.
Yeah. If you label yourself in that group, please reach out to us because we would love to have more folks involved in this process each year. It is a big lift to bring everything together, but it's a great group to work with. And some of these questions and things that have been raised here are excellent points and things that we want to be aware of as we build these reports going forward and making sure that we're helping to answer, stay mindful. So, oh great, good. I see folks dropping in the chat. Would love to get involved. Thanks, Susan. Reach out to us, let us know. Jason is a great point of contact for that. And this is all considered part of the campaign to end homelessness. It's also a product of the Michigan Homeless Policy Council, which is under the Michigan Interagency Council on Homelessness. And I tried to avoid all acronyms in that sentence.
You did a great job. So I second everything Christina just said. And we do have one more question before we wrap up. So Melissa is asking, is the data that is related to children that you went over from HMIS?
Yes. So page 11, all of the statistics up until that last bullet point or the last section around domestic violence are all pulled from our HMIS system. And even the HMIS, the domestic violence numbers are from the HMIS system, but there was an additional data source about the national trends, which is why I was saying that there's some other data sources in play. Yeah, you're more than welcome, Melissa. And thanks for asking those clarifying questions as to where things are coming from. So, and that's actually a good point. Generally speaking, if we don't cite a different data source and we have a data point that's referenced, in particular a statistic or a number, it more than likely came from HMIS. It's kind of the standard metric or the standard reporting tool that we were using. So we try to be fairly specific and intentional in naming our external data sources. So it was pretty clear when we were going outside the HMIS system. So I also will just add that I dropped my email in the chat. So if following up from Christina's plug for the writing team, if folks are interested, please drop me an email and hold on to your information. I think we're going to take a little pause here after just dropping this report. I think there will be a little pause. Yeah, just a little one. But it would be good to hold on to your information and definitely can keep you in the loop as we ramp things up for next year. And I will echo Christina's sentiment around what an amazing writing team we had. Also, you know, the fact that every year we have at least a handful of community partners. So, you know, it's a lot of kind of folks at the State Department level, kind of seeing the big, you know, macro level data trends. But it's always good to have some community level folks to kind of keep steering us in the right direction, so to speak, and making sure that we're paying attention to like some of the things that some of the trends that we've been discussing during this webinar.